Welcome to the Motherhood Circle video series. I'm Ashley, your host, and I'm really excited to share this episode with you. I have the holistic tooth fairy on today. You may be thinking, what is a holistic tooth fairy? Don't worry, we're going to get into all that in this episode. We're also going to talk about how you can look after your teeth in pregnancy, give your baby the best outcome with their teeth during pregnancy and once they're born. We're going to bust some of the breastfeeding myths around teeth and dental hygiene. And also, she's going to give us 3 practical tips that I am itching to get my hands on so I can start implementing them today. So as I say, grab a cup of coffee, a cup of tea, snuggle up and enjoy. Introducing the Holistic Tooth Fairy, a natural oral health coach working online to support families all over the world to have strong teeth and healthy gums. She had terrible teeth all of her life until she prevented root canal by changing her diet. Now she can help and prevent tooth decay and gum disease with natural, intuitive, and self-help strategies. Hi, Meliors. How are you going? Thank you so much for coming on the channel today. I'm really excited to have you here. How are you going?
I'm great. Thanks for having me, Ashley. It's really wonderful to get to talk to you and your mum.
I know, and I'm really excited because today you're going to be talking about something that really I'd never even considered before I actually came across you on Facebook, and I started to probe a little bit into what you're about, and I got a little bit curious because I am into holistic health. But you're the holistic tooth fairy, so can you tell me a little bit about what a holistic tooth fairy is and how you came about your work?
Yes, so as a holistic tooth fairy, I help people heal and prevent tooth decay and gum disease with natural, intuitive, and self-help strategies. And I got into this really because I had terrible teeth. So I don't have a background in dentistry or health. I was a policy analyst, a counsellor, an artist, all sorts of things, but I always just had problems with my teeth. And then about 6 or 7 years ago, I was able to prevent what would have been my 7th root canal. That's how bad my teeth were.
Wow.
By changing my diet.
Wow.
And that happened really quickly. And so I was told I needed a root canal. I did some research, I made some changes, and within 2 weeks I went back to the dentist for the root canal, and he agreed with me that I didn't need it anymore, and I've never had that root canal since. And that felt like such a miracle after my whole lifetime of just constantly having major dental work done for painful problems. So I threw myself into learning everything I could about alternative approaches to oral health, and gradually started to build up this picture, which is really, there's 4 pillars to natural oral health, or my understanding of it, my approach to it. And there's nutrition, which is really foundational. But there's also the jaw, relaxing the jaw, which also relates to how we breathe, yes. And
I'm relaxing my jaw.
That's right. So basically it's kind of the mechanical systems around our mouth, that whole category of healing strategies. Then of course there's oral hygiene, and everyone knows that you're supposed to brush your teeth and floss them, but there's really quite a few things that people don't know about the best ways to keep their mouth clean. And then the 4th pillar is what I call the metaphysical, and that's looking at what are the emotional, psychological, spiritual, or ancestral influences on our oral health. And that can get into things like energy healing and the meridian systems, and all kinds of interesting things that actually play a really big role, both for adults and children. So anyway, about 2 years ago, I was really being asked by a lot of people for advice about how I'd healed my teeth. And so I decided to start the Holistic Tooth Fairy business. And now I work online with clients all over the world, including lots of mums and children. So I work with the mothers to help heal the children's teeth. So that's a part of my business that I really enjoy, and I'm looking forward to talking to you about today.
I'm really excited. I really believe in holistic healing, and I know that years ago I probably would have thought it was a bit woo-woo or a little bit crazy, a little bit witchy or something like that. But I've learnt myself through, I mean, it just makes sense, doesn't it, to eat nutritional food that is good for you, to, you know, live a prosperous and healthy lifestyle. And even when you mentioned about the jaw thing, I know when I'm doing meditation, a lot of the meditations go through relaxing that jaw. And even in birth, they say to relax that jaw. And it's amazing how connected all of our body parts are and our minds. And so I'm really excited to learn a bit more about this. But the first thing I wanted to ask you about is, so what can mums do during pregnancy and the first year of baby's life to protect their teeth?
So pregnancy and breastfeeding in particular can be really depleting for teeth and gums. And there's an old saying of every baby a tooth, because it was so common for mothers to lose a tooth every time they had another child. And that's because when your body is building a whole nother human and building that human's bones and teeth, a lot of minerals are needed to do that growth of the fetus inside you. And so if you're not getting enough of the right kind of nutrients in your diet as the mother, then Mother Nature's going to prioritize the baby and draw down on the mineral storehouse that is your teeth and your bone. And the jawbone is the place that we often see depletion of bone health most visibly in our body, because you can see the gum's so thin, you really see what's happening with the jawbone more clearly than you do like in an arm bone or a leg bone. So I see a lot of mums who had perfectly fine teeth and completely healthy gums, never gave it a thought, and then they start having children and they get cavities, their gums start receding, they have lots of problems, and that's because they weren't getting enough of the right kind of nutrients for building teeth and gums during pregnancy and after the baby's born. So the most important thing that I would like to encourage mums to do is make sure you're nourishing yourself. Even if you finish breastfeeding, even if your children are older, you're still going to be physically depleted from having built that whole other human being out of your body. So teeth and gums need a mineral-rich diet, and unfortunately, most of the food that's available to most of us is not very nutrient-dense. It doesn't have the high levels of minerals that are really needed, and that's to do with the way that agriculture has depleted the soil. And so, you know, we get beautiful food at the supermarket, but it doesn't have the same level of minerals that organic food does. So that's a reason why organic food is actually really important in pregnancy and afterwards, is because will tend to have a higher mineral content. You also need fat-soluble vitamins. Those are vitamins A, D, and K. Those are most easily accessible in animal products. So, yeah, that's important for nourishing yourself and rebuilding your storehouse of minerals so that you can be strong and healthy for your baby as well. The other thing, of course, is to make sure that when you're brushing and flossing, that you do that gently, because most of us brush really vigorously. We sort of do this back and forth motion with the toothbrush, but really that can do a lot of damage to gums. So when you're brushing, just hold it between your fingertips, not in a fist, and brush gently, because that will get your teeth clean and avoid damaging the enamel and damaging the gum.
I think when I was pregnant, I noticed that when I was brushing my teeth as well, that there was a lot of blood coming out, which wasn't normal, but I think that's pretty normal in pregnancy as well.
Well, it's normal in that because your gums are being depleted, that's a symptom of the depletion. So if you nourish the gums with a mineral-rich and fat-soluble, vitamin-rich diet and brush and floss gently, you're less likely to bleed.
Sure.
So, yeah.
And you know, it's interesting that, you know, when you go to the hospital and they say, do you go to the dentist? They say, you know, because you need to look after your teeth, do go to the dentist. They don't actually say to you, these are some of the things that you can be doing or whatever. They send you to they say, do you go to the dentist? And I did go to the dentist. I had a lot of work done. I had braces, and so I was regularly seeing the dentist. But when I go to the dentist, they don't talk to me about any nutrients or anything to actually protect my teeth. They talk to me about using toothpaste, flossing, and just you're here to get another filling or you're here to get another blah, blah, blah. And that's not really helpful. It's not really helpful when you're pregnant and you're going and then you've got to go get another filling or, you know, something chemical related put over your teeth or something like that. So it's just very interesting how our system, our health system set up to basically band-aid the problem rather than actually prevent it to begin with, which is what you're talking about, preventative care, so that we don't have to deal with like fixing it afterwards, which I really love. You mentioned some mineral-rich foods, but could you just list off a couple of those for us? Because on myself, I don't even know what mineral-rich foods are, which is really sad.
So seaweed is a really
Wow.
food. So you can sprinkle kelp on your meal. You can take it as a supplement, or you can eat a lot of sushi. So the rice, there's other issues with sushi, but that's like the place you're most likely to see seaweed, you know, to buy ready-made. But so there's a lot of minerals in seaweed, and it's really the quality of the food rather than the type of food. So the closer a food is to being grown without chemicals, the more likely it is to be mineral rich. So because the way that organic food is grown replenishes the soil, puts minerals into the soil instead of just putting using chemicals to kind of grow it with the soil as a medium, you know. It's a funny old system we're living in around food.
I know. It's funny that we call it organic when it's really just food growing. You know, like it's like this is the chemical food, but we're not going to call it the chemical food. We're just going to call that the normal stuff. And this is the weird organic stuff that only healthy, juicy people eat. But really, this is the normal food that you know, that we're not told about is normal. It's
well, before
really
the 1940s. Before the 1940s, all food was organic.
Yeah.
They weren't getting the phosphate fertilizers. But anyway, so that's you don't have to like change your diet really radically. You just need to improve the quality of the foods that you already eat. And I'm sure you and your listeners know too that, you know, whole foods are better than processed foods. The more foods have been processed and packaged, the less nutrient density there is in those kind of foods. And so just those basic common sense things around what you're eating will help to support your teeth gum.
And it doesn't even have to be expensive. I'm a bit of a gardener myself, so I've got a little garden patch, and I'm looking at it at the moment. It's just full of herbs, and I'm like, okay, so I need to get my lettuces going and my carrots and really start getting some stuff out there, which is really cheap because you can get a little pot of 4 for $2.50, and even cheaper if you plant your own seeds. So it doesn't have to be expensive. It's just we have to put a little bit of time and effort in, which is actually helpful to mind and body and all of those wonderful things anyway. So there are other options if you are thinking, oh my goodness, organic food's expensive. You can put it, even if you live in an apartment, you can put them in pots. So I just wanted to put that out there so that if anyone's watching and they're thinking, oh my God, this is expensive, when you think about it over long term, a root canal is like thousands of dollars. So anyways, I would much rather not have to go through that process because it is painful as well. But the next question I want to ask you is, so what can a mother do to help her baby's teeth to be strong and healthy? So she's had her baby, what can she then do to help her baby's teeth?
Well, actually, it starts very soon after conception. It's at about 3 weeks after conception that the tooth buds start to form in the embryo. It's still like a blob before it's even looking like a fetus, a baby. The tooth buds of both the baby teeth and the adult teeth are starting to form. And so actually right through pregnancy as well as early babyhood, even before you ever see the teeth emerge through the gums in your baby's mouth, those teeth are developing and well, they're vulnerable to environmental toxins. So one of the things to do to help protect your baby's teeth at any age is to minimize exposure to toxins, and that includes like antibiotics is really well known to you take them at certain points in development, it can cause a condition called enamel hyperplasia, which basically means that baby's teeth don't have enough or any enamel, depending on how serious it is, cause discoloration in the teeth, and so on. So, and then there's environmental toxins, and once again we come back to organic food, but also looking at the water that you're drinking and making sure that that's clean. That can all affect the development of teeth. But then on the positive side, that nourishing diet that's going to keep yourself healthy during pregnancy and afterwards, the minerals and the vitamins and so on, that will nourish baby's teeth as well. So you don't have to do anything different to build up baby to have strong teeth than you're doing to take care of your own teeth in terms of diet. With the baby, one advantage of making sure that you're really nourishing yourself and your baby with these kind of good nutrient dense foods is that they're likely to have a broader palate. And so the palate is the top of your mouth, and the broader the palate, the more room the teeth have to grow in straight. So one of the reasons why so many children and adults get orthodontic braces is because their palates are too narrow for the teeth to grow in. But the narrowness of the palate is affected by the nutrients that we eat. So that nutrient-dense diet will help to avoid the cost of orthodontia later in childhood, and that's going to cost a lot more than organic food costs now.
Yeah, wow, that's full on, isn't it? It's just amazing how everything starts from the beginning. Like, I never even knew this stuff, and I'm like, when I have baby number 3, I'm going to be like ready to roll. This baby's going to be amazing.
Well, the good news is that you can actually influence the shape of the palate at any point through your life, right up into adulthood. It takes longer and it has less of an effect the older you are. But right through childhood, by improving a baby's or a child's diet, that will help to broaden the palate as it grows, because they're still growing. So never too late.
Oh, wow, that's amazing. Oh, God. Well, you've also got, I know, I'm really intrigued, and I'm so excited because I'm going to learn so much more from you. You've also got some tips that you would like to share for mum and baby as well, with the audience as well. So can you let us know what those are?
Well, first of all, it's a tip, but it's also a little bit of a bugbear I have, because I see and hear from so many mothers who, when they take their child or toddler to the dentist, are told that they shouldn't be breastfeeding, that their breastfeeding is harming these children's teeth. And it just gets my goat, because it's not the breast milk, it's not the breastfeeding, it's, if anything, it's the interaction of the carbohydrates in the solid food that your child is eating with the breast milk that can cause decay. But it's not the breastfeeding, and I would never ever want a mum to stop breastfeeding because a dentist has told her that's harming her child's teeth. So you can help prevent decay occurring while you're breastfeeding by making sure that you clean off the solid food from your baby's gums, from your baby's teeth, before you put them on the breast. And then the breast milk won't be interacting with the carbohydrates and turning, what it does is it kind of makes the mouth quite acidic, and that's what can cause decay. So if a baby's got clean teeth, it's safe to even breastfeed them through the night.
Okay, so basically get a washcloth or a toothbrush or something and just clean down any food that's on the teeth and ready to go, basically, and then it won't cause any problems. That's very interesting. it's interesting that that happens, and then again, there's misinformation out there. I mean, I continue to hear from people about this, and I know from my own experience the lack of real knowledge and help is out there. So I think, like, how easy is that, just to clean your baby's teeth and voila? Because I know there's a lot of mothers out there who feel really guilty. On one hand, they're trying to do the best they can for their babies, and the next hand they're being told you're doing the worst job in the world and you've basically ruined your baby's teeth, and that's not the truth at all. So it's good to get that knowledge out there and support those moms.
Yeah. So I just feel really strongly that mothers shouldn't be being blamed for causing this problem by their breastfeeding. Mums have got enough that they're feeling guilty about that on top of everything else. So my next tip is one for the mums, which is to drink nettle. So stinging nettle is a really common, very affordable herb. It actually grows as a weed. So if it's a weed in your garden, if you're not growing organic veggies, you're just growing nettle weeds, that's all good. Pick it and pick it with gloves, because it is prickly when it's fresh. And make a strong tea with it, a nettle infusion. And that is so mineral rich. It's one of the highest mineral plant foods that you can eat.
Wow.
It's high in protein. It's great if you're on a plant-based diet. So vegetarian and vegan mums in particular, you should absolutely be drinking nettle every day. It boosts breast milk production. So if you're nursing mum, it's safe in pregnancy and it will help nourish you and your baby through pregnancy. There's really nothing that nettle can't do. I can't speak highly of it.
Wow. What does it taste like?
It tastes a bit grassy. There's a debate in my Facebook group between the people who hate nettle, hate it, and those of us, I'm drinking some now, who don't mind it at all, So, I do have some tips. If you really hate the taste of it, add in some other herbs or put it in your smoothie. But you get used to it eventually, and the value is so high. Like, it's what you get for spending not very much money and a little bit of time to make this drink every day just so exceeds the effort and cost.
Well, I'm going to be getting myself some a nettle bush for sure. I'm going to go out and get some and get it growing, and then see if my kids notice a change in their water.
Yeah, right. Yeah, and you can just buy dried tea in health food stores, and that's one of the cheapest herb teas you can buy. So.
Awesome. I'll do that.
And my third tip is for baby, and to make sure that your baby is breathing through their nose and not their mouth, because mouth breathing does contribute to decay, and that's actually one of the ways that even if you're doing a good job of cleaning their teeth before breastfeeding, if they then come off the breast and are sleeping with their mouth open, that can contribute to decay developing. So just push their mouth shut, just touch their chin shut while they're asleep. They won't wake up, and that trains them to breathe through their nose. And if you see them mouth breathing during the day, try and encourage them to close their mouth and breathe through the nose. If they really aren't able to do that easily, you may need to look at their sinuses, see whether they've got a tongue or a lip tie. There may be some wider health issue that's getting in the way of nose breathing, but the outcome for their teeth is so important to make sure they're breathing through their nose. So that's
awesome tip. I think we've had so many good tips today, and I'm really excited to actually start implementing them. But I'm also really excited to learn more. I feel like, and even from the very first time that I saw what you were doing, I've always wanted to take that step. So anyone who's watching, how can they get in contact with you? What's the best way to get that information so they can start improving, their dental health, but also their family's dental health as well?
Sure. So, well, I have a page on Facebook called the Holistic Tooth page. That's a good place to start. I also have a website called holistictoothfairy.com, and there's a lot of resources in there. So if you go to the resources section and like search baby teeth or any other topic that's interesting to you, like food for teeth or nutrition for teeth, is the search term. But you'll find a lot of resources in there. But if you'd like some more personalised support to really get started with implementing these changes for oral health into your family life, I have a paid membership program called Teeth for Life. And we've got a lot of mums and families in the program. So a lot of our conversation and our resources are around supporting new mothers and babies and children's teeth. It's just $38 a month or $388 if you want to join for a whole year. And you get, for that subscription, you get access to a resource hub. So that's a website full of all the tips and tricks. Most are in like 5-minute video form or a PDF to download. So I've made it really bite-sized to fit into a busy lifestyle. You can learn a particular little hack to your life, watch the video, put it into practice, and then when you feel like you're ready to add in another layer of strategy, you can come back and watch another one. So there's a resource hub, there's a Facebook group, which I mentioned before, very warm, supportive, inspirational, helpful community, and I make sure that there's prompts coming up in your feed, your Facebook feed every day that help remind you, like, have you had your nettle tea today? Or your jaw tense, here's a little relaxation exercise, things like that to help stay on track. And then the third element in the membership program in Teeth for Life is live group coaching. So you can get personalized coaching with me in a video call as part of your membership in a small group setting where you should have 4 or 5 people on the call. So it's very intimate. And bring your questions along and we will problem solve. We'll figure out what you and your family need to be able to have strong, healthy, resilient white teeth and not need drilling and filling at the dentist.
Well, I think that sounds amazing. I know a few people who are going to the dentist to go get a few things done. So I am looking forward to sharing this segment with them and for new mothers as well, so that we can look at a cheaper, healthier, holistic way of looking after ourselves. And I promised you I was going to join. I still am going to be joining your community because I'm really excited as well. So I'm glad that you mentioned that it's little bite sizes as well, like little 5-minute videos, because as mums, we're super busy. The last thing we need is like hours worth of videos going on. So I am really looking forward. So thank you so much for coming on and sharing your wisdom and your knowledge.
You're welcome, and thank you for inviting me. It's been really enjoyable.
Thank you. Thanks for watching this episode. Make sure you subscribe to this YouTube channel, our mailing list, and follow us on our social channels so you never miss an episode. All our details are listed in the description box in YouTube. I look forward to bringing you another great episode next week. Welcome to our circle of support, Mama, with the Motherhood Circle. See you next week. With love, Ashley.